All right. I think I see the recording button on. Good morning, everyone. Again, all these waves. That was wonderful. First of all, it's so great to see everyone's faces, and I miss you so much, and so many familiar faces, which is so wonderful. I'm glad that I'm hoping that everyone is healthy and has been safe during this time, which has been what we've called, very unprecedented, but there is also opportunity, and today talks about the opportunity to continue to do some great work. But before I start, this is our what Jim has said, our 2020-21 Human Services Block Grant that we apply for every year, and we do these public forums to get input. So this morning really is all about you all. So I'm going to tell you a little bit about that, and I have some questions that I'd like us to focus on. So I'm going to share my screen. All right. Oh, okay. And then do this. All right. Hopefully everyone can hear or see this. So again, I'm Tarika Dan, the director of Montgomery County's Department of Health and Human Services, and I am joined by Penny Lafferty, who's our assistant director of the department. And Penny, I don't know if you can wave. I Penny really is the real expert for the HSBG, is what we call it. And so any tough questions or easy questions, I'm glad she's here so she can answer them. Also, Jim, thank you, Jim, for that fantastic introduction and a fantastic understanding of what we're going to, what we're going to do today. Thank you for that. And I think we're joined also by Laura Gonzalez, who is going to take actual written notes. So we're recording and also having written notes, which are a requirement for this. So again, this is an unprecedented time, but again, this is a time of opportunity, a time to continue to do really good work, and continue on what our mission is. All right, so let me forward this. And I don't know if Penny, you wanted to say something before I continue. All right, so let us. All right, so. For the past the Human Services Block Grant, or HSBG, are funds annually allocated by the state of Pennsylvania to county governments. Montgomery County is one of them, to provide locally identified county-based human services to meet the service needs of county residents. Now, for the past 2 years, Montgomery County received around $41 million. But as many of you know, at the end of May, Governor Wolf signed what they are calling a short-term budget that commits to only about 5 months of funding at mostly 2019 funding levels, including general level funding for human services. We're not sure how the HSBG funds are affected. We're assuming that we may get the same amount, but again, with this very limited budget and level funding, we know there's still opportunity to advocate around making sure that human services funding is strong, robust, needed. Again, at level funding, there's some good and bad to that. Level funding also means that some of the needs that were increased aren't being addressed, and there's still some gaps. And so this is a real opportunity to advocate. So that's just a plug to advocate on behalf of our human services, our work, and the vulnerable people that we serve every single day. And that we are still working under funding uncertainty, right? So we're going to move forward and really keep hope high, but there is still opportunity to advocate, and the recognition that we're not sure what the future will bring. But for HSBG, there are specific categories and specific focus populations for this money. So the eligible categories here you can see on the screen: mental health services, intellectual disabilities, homeless assistance programs, drug and alcohol programs, what they call the Human Services Development Fund, or Human Services and Supports. And those are for generic services, specialized services, service coordination, really to fill in some gaps to services for the unserved or the underserved and unique needs. That falls under that category. The populations specifically covered for the HSBG are low-income adults, persons experiencing homelessness, aging and aged persons, or seniors, persons with drug and alcohol addictions, persons with mental health problems, persons with mental retardation, and dependent and delinquent children. So again, I had said that this time really is for all of you to tell us what you're seeing, kind of what some trends, some needs, some gaps, and we'll have pointed questions. But before we go into that, I do want to say, and then we'll definitely, you can have questions during that time too. But I always love to start these discussions with this comic. I think I did this last year too. And it says, "What will the new year bring us?" And the other one says 365 opportunities. So the thing about planning and budget seasons are they're challenging, but it's also time for hope. And we love to start with from a place of possibilities. I was on a training and they said that, and I heard the speaker say, and I did look it up, which is true. That's a Japanese symbol for crisis are two symbols together. One is danger, right? So a crisis, which what we're, we're experiencing definitely with this pandemic, right? There's danger to it, right? The other symbol is the symbol for opportunity, right? So we have to recognize that this is a hard time that people are struggling. They will continue to struggle. And that, of course, the danger of the pandemic, right? That we have to do things so differently. But then there's also this opportunity to learn, opportunity to invest in things that are going to make a huge difference in people's lives, opportunity to serve people in different, creative, new, stronger ways. So that's how we're approaching this in our department. So these are the questions we would like people to answer. And I'm not going to go one by one, just whatever you want to answer, please do. And I wanted to say, although public comments and forums and hearings are required by the state as part of this application and planning process, we absolutely would do this even if it wasn't required, because we truly believe that we can only go forward and respond best to the needs of our community if we bring together expertise like all of you have, the expertise of our staff, our service providers, clients, family members of clients, and community members. And that means giving a truly inclusive time and space for all of your voices, all of their voices. And this is a piece of what this is today. So what real quick is that the ideas and the feedback input we get today, we bring back to our internal planning process and decision-making process. We also share your comments. We share this recording with the state, and we also consider we look at other possible opportunities and partnerships. So maybe not everything said today or when we have our listening sessions can fit into SHBG. It's still limited funds, or maybe not quite eligible, but it gives us an idea of other ways that we could partner, other ways that we can do work or invest our funds and resources and our time and our staffing. So all of this is not, all of this really helps us move forward in our planning, in our efforts. All right, so I think Jim said, again, raise your hand if you have a comment, and he will kind of moderate that. But now I'm going to open it up to anyone who has a question or a comment, and kind of looking at these questions, right? So what should the priorities be for the county? What are the community needs that you see? What current effective programming should be expanded and or duplicated, right? What's really working well? And you're like, wow, if this was bigger, if this had more resources, if this was in more parts of the county, this would be great. Are there service waiting lists that should be addressed, right? So when there's a waiting list, that means that there's something going on there, right? Whether it be it's not resourced properly, or we may have to look at how the process is, right? We want to hear that. And then finally, what are some service gaps, right? What are some needs that are going unmet? All right, so now I'm going to be quiet and officially turn it over to you all. I'm going to keep this up on the screen just so that people can continue to reference it. All right.
And you raised your hand?
Yes, well, Elizabeth Joan, who is with Pennsylvania Link, I think everyone can see her comment, her suggestion, that it would be great if one of the priorities was landlord-tenant mediation to deal with the tsunami of evictions on the horizon. Now, we also have, I noticed we have Daniel Cortez who presented. He's with the Legal Aid of Southeastern Pennsylvania. And he gave an incredible presentation at our last ICN meeting with suggestions for folks. You know, maybe that's something that we can consider. Yeah, I would agree. There's going to be so much greater need. We all can expect to have that, and I think maybe taking into consideration, you know, why are some population, perhaps some of the inequities that already exist that have come forward, I think, you know, in these last few days, in these last few months, that I think folks who don't speak English and maybe don't have their documentation, their legal permit to be in this country, but they may have citizens, children, and certainly African American populations, whether Blacks are as likely, or what is the experience that they may have when they do ask for support.
Great, thank you. Now I see Daniel's raised his hand.
Yes, if I could add to that, thank you for bringing up the fact that I presented that. So at Legal Aid, what we're going to be doing is we're going to be hiring additional attorneys to be able to support the tsunami of evictions that we're expecting. The area that we cannot serve is that undocumented population. So if somebody does not have legal status, because we are federally funded and an LSC organization, we're not gonna be able to provide an attorney for that person who is facing an eviction. Additionally, the Pennsylvania Finance Housing Authority released the rental assistance program. The pitfalls in that program is that it's only limited to a rent of $750. So somebody that lives in a house, maybe that they're paying $1,500, the landlord, I'm sure, is not going to settle for $750 in rental assistance. So if any of this homelessness prevention money can be used to address either those rents that are way above $750, or it can address families that are undocumented and would need services that we can't provide. I think that would be a great need. And then also that language access. I know that, for example, the Pennsylvania Finance Housing Authority's rental assistance application, they said that they're going to be providing it in Spanish, but they haven't done so already. And I know that, you know, I think it's a struggle that all our organizations struggle with, is making sure that we have a friendly, comforting environment that is accessible to those that speak Spanish, those that speak maybe other languages that are not English. So I think that for the COVID-related homelessness issues and housing crisis that I believe we're going to have, especially once the unemployment expires, the additional $600 a week in unemployment is going to expire at the end of July. I think that meeting that need, especially for the immigrant community that we might not be able to fully serve because of our restrictions. I'm not sure the restrictions on this money, but I think if there is no restrictions, that would be a great need.
Thank you. Deborah Curtin has a raised hand as well. Thank you, Daniel.
Hi, everyone. I'm Deb Curtin. I'm a senior director of crisis and behavioral health at Access Services, and I oversee the street outreach team for Montgomery County. We are currently seeing about 190 street homeless individuals in the county. They're a small team of just five, and we are always looking to, every year we are a little bit at risk of losing some of our funding to fund that program. During COVID, we've remained mobile, we've remained accessible to the street homeless. And so definitely I would ask that the street homeless, the wait lists to get into shelters are still long. People are seeing about a 3 to 6 week, sometimes longer wait to get into shelters. These are people living in tents, living in encampments. They're utilizing community services that through COVID has shut down, places where they go to get meals. You know, we've partnered with some of the community resources still opened, but a lot of them have shut down during COVID. And I'd also just like to, request some sort of braided funding opportunities for mental health and housing initiatives. Right now, we're piloting a street medicine project in the county where we're attempting to integrate services across human services to bring services to folks on the street. We're looking at creating teams of a drug and alcohol provider, a mental health provider, and a medical provider all at once to kind of go into these encampments. And we're at a practicing phase in that. But definitely a priority for the county would definitely be to fund the street outreach team to continue to be able to provide services to the literal homeless, to get them on those waiting lists for shelters, to help move those waiting lists along. And then new initiative services integrated, to be able to bring all services that the county offers to those most vulnerable who face barriers to going inside to receive these services. So that's what I would like to push for. Thanks.
Thanks, Deborah. Nanette, I don't want to put you on the spot, but I thought I saw you raise your hand. Yes.
Thank you so much. As I'm with Advocates Against Hunger, serving Norristown and Montgomery County, and our focus has been really on food insecurity and looking at the response the county has given is just extraordinary. And I have to compliment Tara and your team and working with the county. I mean, Health and Human Services has done a spectacular job. We've worked with Jim and Elizabeth, and we just appreciate all of the support that the county has given so far. I mean, it's very positive, and I think this is exciting that you're asking the questions. So from a food insecurity point of view, we deal directly with pantries and soup kitchens, and we're part of the Montgomery, the MAHN, M-A-H-N, and I see Madeline Wico is on this call, so she might be able to help with some of this as well. But looking at the response of the community to hunger issues and food insecurity, and I will have to say the MAHN has been terrific in being able, as a countywide, with Patrick Druhan, with Montco Hunger Solutions, to really focus on what those needs are and to deliver emergency food in this pandemic. And so it's been very positive. We do fresh produce, working with Phil Abundance in the SHARE program. And I think it's working well. Whether this will be sustained over the long term that we're facing, because we're just in the beginning stages of this. So I'm very hopeful that we don't lose sight of food insecurity and getting food directly to people who are too afraid to even come to pantries. We see the need, and a priority need, for being able to create a system where we can deliver food to those who are in need. So hopefully maybe the county can work vis-a-vis different grocers, Phil Abundance, looking at this larger picture of how we can make delivery, the transportation effective within the county. I mean, the other issue that we face is we have been involved as advocates as being a facilitator in the initiation of the Montco Multi-Faith Coalition. And that is getting people together from a faith perspective to who people trust, their faith providers. They trust to connect them with services. So I'm very hopeful that the county looks about, and we have had the support of Commissioner Arkush and Ken Lawrence, been fabulous in this process, but to realize that we need to focus on creating these links that are probably untraditional, but are so important to get the message of what services exist and linking those people within the community where they might be a little afraid of a government entity to link them to services. And then the other thing I wanted to say was our work in the Norristown area, where all of the food insecurity is really addressed by faith-based entities, and that is not something the government has usually supported in terms of channeling funneling financial support. But many of these congregations in towns like Norristown are very small churches. They themselves struggle with food insecurity, and yet they've borne the brunt of the financial wherewithal. And I think faith leaders can speak to the conscience of the community, but the faith community isn't the one to bear all the burdens for feeding the community. So I think what we need to look for is how does this food insecurity better addressed using the groups that we have to reinforce and help them. Thank you.
And I see that Catherine, you had raised your hand.
Yes, hi everybody. I see that Elizabeth Doan mentioned the social isolation among seniors. As part of the Montgomery County Association for the Blind, we have quite a number of seniors who are visually impaired or who are totally legally blind and have been very much isolated during the pandemic. And even in the best of times, they don't get to the senior centers, they don't get to recreational programs or leisure programs. And then there are also people with disabilities who are adults, other than blindness, who are quite isolated. I think there would be a great need to somehow provide some resources for them to connect with others, even if it's by phone, maybe a mentorship program where two people with similar circumstances could be put together to talk to each other over the phone. It just seems like the isolation is something that is difficult to tackle because it's more nebulous than, you know, something tangible. So that's all I have.
Well, thank you for seeing that. I thank you, Elizabeth, for recognizing that. As I mentioned, my full-time job is with seniors, none of whom have Zoom. It's been, you know, particularly for those who live alone. And I know that Tara, I know that the Office of Senior Services, formerly Aging and Adult, they started a program where volunteers would phone and have telephonic conversations with seniors, but then the program was stopped. And I know RSVP will do phone check-ins. They've had a lot of volunteers recently. But I'm wondering if, yes, if that program, one, identifying those individuals and then making sure that it's not just a check-in, but it's an actual friendly, a relationship. And it can be with volunteers, but it does take somebody to organize that. And wondering if maybe RSVP with some assistance from from your office. And then I was also thinking about some of the other statements that were made by Nanette. And I think I don't know if anybody's on the call, but definitely I feel there needs to be, and Jim, this relates to your job, and I suppose to some degree ICN's mission, which is this integration and having a stronger relationship with re-entry programs, prison re-entry. There have been people that have been let out of prisons during COVID, and they really don't have the resources, the support. They may not have housing. They may not be eligible for so many of these public programs. So I think integration and collaboration needs to be enhanced somehow. And we need to consider those people who have been, the many people, the countless people who have been imprisoned. And oftentimes I go back to the fact that they're generally Black and brown. And I think that's important for us to recognize. Thank you. Anyone else?
Jim, I see that there's a comment from Madeline about the transportation. Maybe Madeline could talk a little more about that.
I feel like Nanette said a lot of what I was thinking, which is that we're seeing really well-stocked food pantries. There's a solid flow of donations and of government food to the pantries, but we're also seeing a lot of people who can't access this food because they don't have a car and they're not, it's pretty tough to carry a bunch of groceries, and walk. And so I think that's one of the main needs that I've been seeing is people calling in and saying, well, I can't get out, but I need food. And so I'd love to see some more, research, brainstorming on how we can connect these people to the resources they need.
And I see a comment from Susan, just again emphasizing the isolation of seniors. But I do think it goes beyond seniors as well. I think it's just individuals who are living alone during this pandemic. And that they're at the senior centers, they have friendly callers, and they're running Zoom meetings, but I know none of my clients have the capacity.
So Anna, let's see if let's bring Susan on. Susan, could you just speak a little bit about the senior center?
Sorry, I was trying to unmute.
Okay.
Yeah, we're working on these Zoom meetings, and it's growing a little bit at a time. But even the seniors that have the capabilities of accessing the programs may not know how to do it. We have a real problem with people asking for the information to come in and be part of the program, and then they never turn up because they don't seem to be able to actually make it work. But we do have staff members at all of our sites that are making calls to check on everybody, especially since Meals on Wheels is being delivered on a more limited basis now. We need to check in with them more frequently and make sure they're okay. Also, our regular members, some of them said, oh, I don't need a call because I live with my son or whatever, but some are getting called every day by staff members just to, chit chat, find out how things are going. So if you have somebody that needs that, that's available. If you have someone who would like to come in for some of the Zoom programs, that would be great too. Let me know. We also have started grab and go meals. Because of going green, we're able to do that. So if you want to have seniors order meals, they can be picked up Tuesday and Thursday, but they have to be ordered the Friday before because the amount of food we're sending out of here is taxing our ability to store it. So if there's anything I can do for any of your members, give me a call, 610-275-1960 and extension 122.
I see Catherine, Susan, if you could stay on the line. Catherine wrote a comment that they have people who are under 65 and are blind, and they've not found a service that would deliver. Is that something that that's available through a Meals on Wheels for folks who are disabled, under and not seniors?
No, they would not be funded. There is an option for private pay. If they pay for the meals, then we can handle it and deliver it. There are also a few other services that do provide this. There's a place called Mom's Meals that you can just Google and pay for them. There also is a group called Caring for Friends that does deliver food to people that are under 65. I'm not sure exactly how extensive their services are during the shutdown, but you can always check on that too. Google them as well, Caring for Friends.
Mm-hmm. Okay. And Doreen just mentioned that the older adult services has Meals on Wheels that covers 60 and over. And Susan, what would it cost for under 60 or not a disabled person who who would want those meals? What's the cost?
To be honest, I don't know offhand, but I ought to be able to get the information before the end of the meeting.
Okay, great. Anybody else have any comments for planning for human services block grants around mental health, intellectual disabilities, homelessness, drug and alcohol, human services development and support, which includes our community connections, Montgomery County?
This is Dave. I just wanted to mention, and I'm sure Tara and Penny are well aware of it, but ICN's been invited to be at the table for the Build Back Better initiative sponsored by HealthSparks. So just the suggestion of, I would expect their final report to be coming out shortly, or they could probably even give feedback in the moment about some of the gaps that they're getting from the 30 plus different human service organizations participants. So just wanted to add that comment.
And Annette, I saw you had your hand raised.
Right. So I wanted to make a shout out to HealthSparks and the Montgomery County Foundation, Inc., because I think we've seen, particularly in the food insecurity, through these grants that the county's been doing, and the safety net focus, it's been so critical and so important that Montgomery County is light years ahead of many other groups. And I think the county can do a lot to really talk to the business community, and they have their own issues and problems through this pandemic. But the county needs to really marshal up all the community, the religious community, the business community, and to really focus on the safety net groups and those that create dialogue like ICN and all of these groups throughout the county that really provide such a horrendous service and fight every year for dollars. I think we need to really look at how we marshal this money to really create this underpinning safety net for the county to make sure that it not only survives but thrives.
Thank you. I see Catherine had raised her hand.
Hi again. Mary Brucker is on the line, and she is my caseworker at the Montgomery County Association for the Blind, and she is blind, and you would notice how difficult it is for a person with that kind of disability to use Zoom.
Right.
So, you know, just make note of that. She wanted to ask or make a comment about housing, rental housing for people who are disabled or people who are over 65 and in low income. This is an important topic for us. You know, how long is the waiting list? Is there a way that we can make it a little bit easier, more accessible, and actually get through that waiting list faster? And that's Mary's comment.
Well, I can personally say that from experience applying for senior housing, that the waiting list here in Norristown, I have never gotten anybody into Sandy Hill Apartments, even though I've helped people apply many times. I also, I know that Rittenhouse School Apartments, they were told by Montgomery County Housing Association that they could no longer pull from their application. They were only able to take people from Montgomery County Housing's online applications. So it was fairly confusing. I had one woman who was like 190 on the list. The only apartment that I've had any luck getting people into these last 4 years that I've worked in Norristown is Jefferson Apartments on 1514 Marshall, and it takes about 1 to 2 years waiting list. The waiting list at Montgomery County Park, the new one, on I guess it's like on Powell, they're no longer taking applications for low income. They have to be higher income. So absolutely, Catherine, that's a very good one, and I'm glad you brought that up. Definitely need to, and also my experience with Section 8 was pretty bad. I've had a couple seniors who have had Section 8 and had been evicted or were in the process of being asked to move, and the availability of Section 8 housing is so substandard. It's bad, and they're getting a lot of money. They're getting over $1,000 for substandard housing. So those are my observations. That's my experience, and definitely would be helpful to look at that. Anybody else? Oh, Nanette?
Yes, one of the things I wanted to comment about is housing for the homeless. Our church was used as a place for people to sleep in the gymnasium, and we made them sandwiches. And so fortunately, the county created Chalk and Your Way Home and had a great deal of support. But it is, I think, needs to be looked at as a concept to better this whole concept about how we house folks. And documentation is another issue. Can it be made a little easier and less expensive for these people to get documentation if they have no money and they're charged $35 or more for that? How do they get their documentation? So a lot of these service groups like oh gosh, I'm having Norristown Ministries, the shelter there in Norristown. No, not Sunundras.
Hospitality Center.
Hospitality Center, right. I mean, that all of these groups that really deal with this at-risk population, you know, they really have to exist by appealing to funders and whatnot. But I think that at the government, the county and the state really need to look at about how money is fused into the safety net system. It's just critical, because that is the underpinning for the whole community. And that's what we're trying to do, is strengthen the whole community to bring people up out of the really dire situations they're in. And I think with the pandemic, but I mean, this is a long-term issue. Much of it is poverty and jobs and access to education, but it's so important to work as a group, and the county has the strength to make these things known to higher levels of funding, because it is critical. Thanks.
Thank you, Nanette. I see that Deborah's raised her hand as well.
Yes, you started to talk about homelessness again, so my eye starts to twitch. I just wanted to add in that our access is a part of the HealthSparks Safety Net initiative that Dave and Nanette mentioned. And I just wanted to add that, like, just thinking about all of this, you know, homelessness is a community issue. So it's very rare that you're going to find a homeless person that doesn't have a drug and alcohol problem, or doesn't have a mental health problem, or isn't involved in children and youth in some way. So, you know, I wanted to kind of push that, you know, and also I wanted to think about the capacity of our crisis programs here in the county. So just mobile crisis and street outreach, and with the pandemic and things starting to reopen and evictions starting to happen again, just really taking a look at, do we have the capacity to handle that in our crisis programs here in the county, because it is going to get bigger. There is going to be a wave. So just really pushing for some sort of braided funding for mental health and housing, and other services too, because all of these issues that homeless people face, like, it's community, it's every single service system into one. So I just wanted to again mention that. Thanks.
I see, Elizabeth, do you want to, would you like to get on and just mention your idea about more promotions of community connections? I think that's a great idea. And honestly, I know that TV often provides public spaces, free public access. They have a certain level of public advertising that they have to provide. So it's, if you see Elizabeth Doan mention, it would be helpful to do some TV, radio, KYW, community connections, so that people who've never needed help need help now, and coming months know where to turn. Do you want to speak a little bit more on that, Elizabeth?
Sure. I mean, one of the things that we know is that people who suddenly need help, who've not needed help all their lives, either don't get any help at all because they don't even realize it's available, or they might just stumble into something. And I will say that Montgomery County is unique within my counties, because you've set up that big front door with the advocates. And I think that's unique in the state as well. I haven't heard of any other county that does that. So that's something you could really promote. It's very simple to explain. You have that one number and then a counselor who can help someone navigate. And I just always worry about not who we know, but who we don't know. You know, who are all those thousands of people out there who, you know, are dealing with something, need help, and just don't know where to turn, or don't turn anywhere because they don't know that there are services. And I know from Chester County that we used to do surveys of the county residents, and it would always come back that the vast majority of people did not even know there was a Department of Aging in their county, much less what services might be associated with those. So I think advertising is helpful. We just ran ads in partnership with a prize, because that's another thing people should know about and don't. And I think it's a way to reach people that we can't otherwise reach.
Excellent. So more publicity generally maybe some funding for that publicity. And I used to work at Philadelphia Corporation for Aging doing Latino outreach. And what I found is if you give the media a small payment for some advertising, they will often then provide much greater access to public announcements. TV, print, and radio, I think, are important, as well as the free social media that's available to all of us. I also noticed a comment. Susan mentioned that, so this is pretty expensive, 2 meals a day. The cost is $14 a day for Meals on Wheels from Norristown Senior Center. So that's something to consider, I suppose, if there's some, I guess this is why, and this is obviously for prepared meals. The other thing I was thinking was, I know a lot of individuals with mental health, with drug and alcohol, with intellectual disabilities that are a little bit more well off or have some support. You know, it's those individuals who do not have support, and so they tend to be the ones that go to hospitality center, the ones who end up going to CHOC and going to the food pantries and the food cupboards. So one of the things yesterday I spoke with a senior services assessor, and they had made the decision. She'd mentioned to me that they'd made the decision, she had made the decision, and the department had made the decision to go and do a home visit for an appeal, for an assessment. And so she had her PPE, and she was willing to do so to try to help this individual who felt that the decision had been incorrect, maybe denying her services in the home. So one of the things I mentioned before, and early in COVID, I think I mentioned this in the HealthSparks survey, was I feel it's, even in my own agency, I don't know who is willing or not willing to, or feels comfortable going and doing more direct service. So I think it's really important for us to just identify those individuals who feel somehow more comfortable going into people's homes when it is found to be more essential, and respecting the fact that some staff, some employees will not feel strong enough to withstand infection from COVID. So in my opinion, I think we need to all of us need to just ask our staff, you know, and identify those individuals who would be willing, and then provide them with the training. I mean, yeah, I also used to work at Valley Forge Medical Center, so the infectious diseases training and the PPE necessary for us to. I have personally made the decision that in some instances when it's urgent, I will meet a client outside and get her paperwork with both of us with masks.
Anna, thanks for all that input. I just don't want us to lose track of Tara and Penny's time. Jim, did you want to guide us to the next step with the summaries?
Sorry, hold on. I was just trying to unmute myself there. I don't know. I pass it over to Tara. Are there other areas that you wanted to ask about or have people focus on?
So if I can just real quick, I wanted to just talk.
Yep. Okay. I'm unmuted myself too. No, I think just that for the closing. So these are. We can also share. I didn't think about this for our last one. Maybe we can share the the PowerPoint to the group too. Jim, maybe I can send it to you and you can send it out, or no, don't send it to you. All right.
Sorry, I was,
but
I was seeing a message from Penny asking if we can hear her, and I was nodding no, we can't.
Oh, all right.
Yeah,
But
definitely send.
yep. And but because really, because a lot of things happen. I'm trying to. Okay, here we go. There's thoughts that come up after our time together. That's like, oh, I wish I said this, or oh, I wanted to get more information, or so and so. I know I shared the discussion with them and they want this input. So please email us. There's definitely time to email us any of your thoughts. Again, answering any of those questions. Any needs that you see, gaps, ideas, anything. I think today was really, really fantastic. And I just want to echo, thank you, Nanette, for your wonderful words and your support and your hard work. I absolutely agree with the wonderful work that HealthSparks is doing with our need to support the safety net. And a lot of what the HSBG does is support safety net services, and the county is committed to that. We have to have a strong safety net. Eventually, we want to get to a point where we don't need a safety net, but until then, we want to strengthen our safety net. So please email either myself, those that email, my email address is right there, or Penny, her email address is there. If you have any thoughts, ideas, more comments. So that we're still totally open and listening, and this is the planning process is still open. And I always get this wrong, so I don't know. I know Penny may not be able to speak, but and maybe Penny, if you can put it in the chat box when our deadline is to receive kind of the feedback.
She had also sent just a message out there that I wanted to communicate out there, is that CARES Act funding and the county will be putting out a message to the community for input. So just keep your eyes out for that as well too.
Great. All right, but that is all that I had to. Thank you everyone so very much. Your input, your voice is so critical to how we're moving forward into the ultimate success of how to serve best the residents, the community of Montgomery County. So thank you again so much. And again, please blow our emails up. We really welcome it. So thank you, everybody.
Dave, did you have anything you wanted to end with? I wasn't sure if you wanted to close out as well.
Again, I appreciate Tara and Penny's time and for looking to ICN to help facilitate this discussion. So yeah, thanks everyone, and be safe, as we all say.
Thanks. All right.
Just very quickly, somebody said it was helpful for someone to speak out as far as the chats. Susan Edgren from Norristown Senior Center wrote down the phone number for Mom's Meals, and it's 877-508-6667. For those of you who can't see the chat. Susan, I was wondering if you wanted to repeat your phone number as far as seniors and who are isolated and maybe could use some additional support.
Sure. 610-275-1960, extension 122.
Excellent. Susan Edgren is also a member of ICN, and she is on the staff of Norristown Senior Center. She's a social worker, and I think it's health and well-being of the seniors. So again, that number, I'm going to repeat it. It's 610-275-1960. Extension 122. And if any of you would like to continue being part of ICN, want to take part in our program development, want to become members, please email us, contact ICN at icnconnections.org, and we can continue to improve quality of life of our folks throughout this community by working together, collaborating. Thank you so much, Tara, Dave, Jim, everyone. And have a wonderful day.
Great.
Thank you.
Thank you.